The next will be one of those most awaited sessions on Introduction to MRCP by our consultant physician, Dr. P. Mayurudan, sir. Sir?
Good evening, everybody. Thank you very much, Sundaresan sir, for giving me this opportunity to do this. This is nothing about the lecture or anything, so I'm sharing some of my experiences to stimulate the young doctors to do the MRCP exam, only for that purpose, not to advertise myself. MRCP is organized by the Royal College of Physicians in UK. So it is a British professional membership body, and there are three royal colleges in UK. So namely, one is in London, other one is in Edinburgh, and the third one is in Glasgow. So what is the MRCP UK exam? It is a membership exam to get the membership of Royal College of Physicians in the United Kingdom. It is a diploma level exam. So it is usually it is done by the SHO grade doctors in UK. So not a MD level exam. So most importantly, the MRCP qualification is considered as a prestigious qualification in all over the world. So whoever is having the MRCP, they are very proud to say, I am having the MRCP UK qualification. So that is the reason most of us are most of us did the exam. And successful completion of this exam is a mandatory requirement to start the specialist internal medicine training program in UK. Say, for example, so here we do the MD selection exam to start a MD training program. So likewise, so in UK, if you want to start the registrar training program, you have to complete the MRCP UK exam. So when you do the MRCP, when you complete the MRCP UK exam, you will be automatically approved to practice in UK by a General Medical Council. So that is another advantage of doing the MRCP exam. You don't need to do any other exams. So straight away you can go and practice there as a registrar. So these are some of my photographs. So after completing the MRCP exam, during the convocation, so I'm sure you might spot me. So it is very prestigious. So what are the benefits of having MRCP UK qualifications? As I said before, you can get the GMC registration very easily and you can practice in UK. And very easily we can get a job in UK as a registrar. So when we go to the overseas training, very easily we can get a paid job. So otherwise, there may be a problem of getting paid job. Some specialities, it's difficult without MRCP. And whoever is planning to migrate, straight away they can start the special registrar training program if they have the MRCP. And you don't need to do the PLEB exam if you have MRCP because it is higher level than the PLEB exam, so you don't need that. So most importantly, if you have MRCP and you can get the FRCP very easily. So FRCP is a fellow of Royal College of Physicians. It is not the exam. So FRCP is coming, or you will get the FRCP qualification only by nomination. Okay, so if you have MRCP and the college is not going to reject your nomination, and very easily you can get, but there are criteria, sometimes they can reject. So depending on the membership, so after passing the exam, you can get the membership. So depending on the membership of the college, you can add it in your qualification. Say, for example, so I'm putting like this because I have MRCP in London, so I'm putting MRCP in London. And also, so I got FRCP in 2 colleges, so I can put, I'm putting that FRCP London and Edinburgh. Sometimes you may have seen MRCP UK, MRCP London, MRCP Edinburgh, MRCP Glasgow. All you can put if you got the membership in all colleges. Only one exam, but you can get the membership in all 3 colleges, and you can put 3 times after your name. So that is the advantage. Only one exam, but you can advertise yourself more than that. So how to apply for the MRCP exam? So it's an online application. Everybody can do that. Okay, so there are 3 components in the exam. So we can do all 3 components in Sri Lanka. So it's easy. So what are the components of MRCP exam? As I said, there are 3 components. MRCP Part 1 and MRCP Part 2. These 2 are written components. And also MRCP Part 2, clinical components, we say PACES. So roughly, MRCP Part 1 exam consists of 200 best of 5 questions, having 6 hours exam, each paper having 100 MCQs for 3 hours. So all are best of 5 questions, but the cost is about £608 to do the Part 1 and also Part 2. So again, Part 2 also is a 200 best of 5 questions for 6 hours. Because this is very easy to pass the exam, because 200 best of 5 questions for one paper, they include each and every part of medicine, and very easy to get about 50%. So the pass marks is not like 50%. It changes each year depending on the number of candidates to the exam. So it's roughly around 50. Okay, so it's not difficult to get the pass marks. So finally, the PACES, the clinical component, we have to do continuously for about 2 hours. There are 5 stations. So in our setup, we know short cases and the long cases or viva or emergency viva. The clinical stations are a little bit different from our setup. So the cost is nearly double the amount when you see the theory exam, but still worth spending this money to have this qualification. Still worth. So you can do that. So some idea about the clinical exam. So there are 5 stations. We say station 1 to 5. And 2 stations are, we say, communication stations. So station 2 and 4, you can see here. Station 2 is a history-taking station. And station 4 is a communication station. So all other 3 are clinical station. So each station, we have to spend 20 minutes. Say, for example, if you take, say, station 1, there are 2 system examination, like we do in medicine, but you will do the respiratory system and the abdominal system, each for 10 minutes. So 6 minutes to do the exam and 4 minutes to present and discuss with the examiner. So in between, there will be 5 minutes break. But we have to do it continuously. So it's a little more tiring to do the exam for 2 hours continuously, but with practice we can do. Then you will go to the station 2, then 3, 4, and finally the station 5. I would like to say a few words about station 5. This is the clinical station. We must pass the PACES exam. So if anybody failing in station 5 is going to fail the PACES. So that is the problem in our system exam and the PACES exam. In our system, we can compensate the short cases in long cases or whatever we can compensate. But in MRCP PACES, we have to pass all the stations, and you have to get certain marks to pass the whole. If you fail badly in one station, then the exam you are going to fail. So that is the system. So what is the reason for us to choose this topic at the BMA session? So what are we doing about MRCP preparation at the Teaching Hospital Batticaloa is the question. So we are conducting the MRCP PACES preparation at the Teaching Hospital Batticaloa. We have started in this year, March, and Jaffna Medical Faculty Overseas Alumni is conducting this preparation in collaboration with the Batticaloa Medical Association and the Jaffna Medical Association. Currently, the postgraduate trainees of medicine attached to Teaching Hospital Batticaloa and Teaching Hospital Jaffna are taking part. But we welcome whoever is planning to do the PACES to this training sessions. There are few people have already joined, and I welcome personally, if anybody is planning to do these PACES, you can contact me. So it's done every other Monday. So we are doing 2 sessions per month. Our next session is going to be next Monday. It's done via Zoom at 6:30 to 8 p.m. On Mondays. So initially we have started station 2 and 4 because it is just a history taking and communication station. So what we are doing there, so ourselves and the examiners from UK joined together, and one of the UK trainee will demonstrate one session with the UK surrogates. So that is the beauty of our preparation. So all these patients are from UK. So one demonstration will be done by the UK registrar trainee, and next is done by local trainee. But the patient or the surrogate is the UK person. So it's advisable for you to join, and you can expose to their accent and how do they talk and how do they expect during the exam. And it will be discussed by the examiner for about half an hour time. Each case we discuss about half an hour. We do only 2 cases per session. It is free of charge. So these are the examiners from UK doing this preparation with us. All of them are very senior PACES examiners. These people migrated from Sri Lanka to UK, and they are very well-known consultants attached to the various parts of UK. That's all. Thank you very much. You can ask if you have any questions. Yes, so I have to tell that. Validation.
Like IELTS or lifelong validation, MRCP?
No, it is not IELTS or anything. It is a medicine exam.
No, sir. The IELTS exam validation for only 2 years. Like, how many years is MRCP?
This is lifelong. If you have MRCP, it's lifelong. You can do now, and you can migrate to UK 10 years later, and you can practice. No problem. Yes. So I forgot to tell that. So there was a period, medicine MD was not recognized in UK. So I also one of that group. I was there because my MD, when I do the MD exam, it was not recognized in UK. So to get the job, paid job in UK, we were struggling. We had to produce a lot of paperwork about our work and experience to get a paid job. But you know that there are a lot of modifications in the MD Part 2 exam recently to get the MD recognized in UK. Now the MD exam, Sri Lankan MD medicine is very well recognized in UK. So therefore, if you have MD, that means Part 2. If you have completed MD, you don't need to do the Part 1 exam. You don't need to do the MRCP part 1. You can straight away do the part 2 and PACES. But others, you have to go through all these 3 parts. Our local exam and the... I don't know anything about PLAP. PLAP is like an undergraduate exam, undergraduate level exam, like a final MBBS exam. But this is little more standard, little more difficult than PLAP. PLAP, I think it carries all the specialities, medicine, surgery, everything. But MRCP UK exam is just a medicine. It's a pure medicine exam. Sorry? Yes. So because if you have MRCP, you don't need to PLAB, and you can go and start a registrar in medicine specialty, any of the specialty, because MRCP is cardiology, they start straight away the cardiology specialty. So in Sri Lanka, we do 2.5 years of general medicine, then we do the part 2, then only we choose the subspecialty in medicine. But in UK, so from the beginning, they do the whatever they want. So if the person wanted to do the neurology, they can start from day 1 neurology training program. So the next item is the most awaited item. So the BMA quiz 2021. So all of you can take part in this quiz, and the BMA is going to give very valuable prizes and the certificates. I hope all of you have received the question papers. I kindly request all of you to try. Let me read the instructions. So please write your name and the contact mobile number for us to contact you and give the prizes. That's it, nothing else. So we were thinking about how to categorize all of you, because from medical students to the consultants. So we have categorized all of you under 3. So first category, please underline if you are a consultant or dental surgeon or senior registrar. Then the second category, registrars, senior medical officers, and intern medical officer. And the third category is going to be medical students any year. If anybody in this audience belongs to a different group, you can ask me, I can guide you to put you into some of the categories. Okay, so there are 15 questions and 1 minute for each question. Remember, there is no extra time at the end of the question. So we will mark only 15. There are 2 additional questions. Those are MCQs. So we are going to mark that additional 2 questions if many candidates get the same marks to choose the person. That's it. Okay. Otherwise, we won't mark the 16th and 17th questions. Those are MCQs. First to 15, you have to write the answers. So I have tried my best to incorporate all the specialities, but if I see all are medicine, anyway, medicine is the vast topic. So remember, only the picture will appear on the screen, and the questions are already in your hand. Good luck. I will tell the question numbers because we don't have a bell. So if whoever is writing, please see the screen when I say the question number. Otherwise, you will be missing the questions. So question number 1. Question number 2. Ooh. What is this? Question number 3. Question number 4. Question number 5. Question number 6. Question number 7. Question number 8. Question number 9. Question number 10. Question number 11. Question number 12. Question number 13. Question number 14. Question number 15. Question number 16. Question number 17. So I will quickly tell the answers, takes only few minutes. Okay, this is one of our patient admitted to ward 4. You can see the outline is ward 4. So he came with bilateral ptosis. This is myasthenia gravis. And we did the simple bedside ice pack test. You can see the water. This is not tears. Ice pack test and improved ptosis. So myasthenia gravis, the name of the test is simple ice pack test. You can see the water here. It's not tears. So this is SVT. The first line drug is adenosine. And we want the complete answer, right-sided, acute on chronic subdural hemorrhage with a midline shift. So this is hemophagocytosis in a dengue hemorrhagic fever. This is the bone marrow. And this is called pseudo-fractures or loser zones. You can see it in vitamin D deficiency, or rickets, or osteomalacia. So this I took in one of the SICU patients few months ago. So dysphagia and Raynaud's. So it's systemic sclerosis or scleroderma. So this is pseudomembranous colitis, so Clostridium difficile. This is subcutaneous emphysema due to multiple stab injuries. So this is one of my clinic patients. So itchy lesions, you can see this is lichen planus. So this is coffee bean appearance is due to sigmoid volvulus. So why he was telling here, almost all the false positive rat tests were due to wrong interpretation of the results. So that is the reason. So we need about 20 minutes to read the test. If you read after 20 minutes, it's going to be anyway positive. And here it's shown negative report. So only control, there is no test band. So you can see here tennis ball appearance. This is dissection, aortic dissection. And this is for pathologists, is focal segmental glomerulonephritis. And here you can see cervical cord compression at the level of C4, C5. And you can't see the disc, it is also there, most probably due to tuberculosis. So this is called high flow nasal cannula, it's each worth 1.4 million. So we got about 15 by donation to the COVID units. So we have this, enough high flow nasal cannulas are available at our hospital. So I requested the director to distribute it to all the wards because most of them are at the store. Yes, so we have to put it into the, no, not atmospheric. We need a wall oxygen or cylinder. So this is called, we have a nasal prone or nasal cannula that is low flow. We can give oxygen only up to maximum 6 liters per minute. So here we can go up to 60 liters, 60 liters per minute. So it's very effective for a hypoxia patient. So I think number 16 is Sir William Osler is the father of modern medicine. I have told medical students many times with a different picture. He is the one told that listen to the patient carefully. They may be telling the diagnosis because that much history taking is important. So you can see the matching picture, I think is image 2, B. Thank you very much.
Thank you, Dr. P. Mayuradhan, sir, for that very interesting session. I would call upon Dr. K.E. Karunakaran, consultant gynecologist and obstetrician, to give away the certificates to Dr. P. Mayuradhan. The results of the quiz and upcoming prizes will be given soon.